Welcome, Dr. Kotapalli. Welcome. Good morning, doctor. We start in 15 minutes. We start in 15 minutes.
Speak. Good
morning. We start in 15 minutes. Good morning, Emmanuel.
Good morning, John. How are you?
Hey, good. How you doing?
All fine here.
Okay, your camera is sideways.
Yes, yes. Okay.
Let's see. Good morning, Mauricio.
Good morning, Dr. John. Long time no see.
Yeah,
Happy New Year's.
How you been?
Good.
Okay, you know Manuel, right?
Yeah, doctor en Encarnación, buen día.
Buenos días. ¿Cómo estás, Mauricio?
Bien. ¿Y usted?
Todo bien, todo bien. Aquí en el frío Moscú.
Sí, está usando un iPhone o qué está haciendo? What are you using, Manuel?
No, the same, the tablet. Wait, let me.
Okay. You'll figure it out, I'm sure.
Yes, yes, yes.
Okay, Mauricio, perfect. You know how to admit people, right, Mauricio? Yeah, just make sure you keep an eye on that. I'm gonna do a little promotion. Okay,
Okay.
Manuel, I'll be back. We got 8 minutes, okay?
Okay.
I'm putting it on all the neurosurgery groups of fate of what's up.
Dr. Bennett, you need to make me a co-host so I can.
Oh, yeah, right. Okay, hold on. Yeah, sorry about that. You know, Mauricio, with the when you admit people, so I just click them all, promote to panel. Do you know what I mean?
I'm sorry, what?
When I admit people, it says admit to panel. For some reason, it doesn't work the first time with some people. So when I go back, I just try to get them in again.
So you want to promote them all to
Yeah,
panelists?
yeah.
Oh, okay.
Yeah, all of them. But some don't want to come in. I guess they're given the option once you allow them in. It says, do you want to enter? And some people say, no, just want to stay here. So
Okay, I got it.
they're classified as attendees. So how are things in Paraguay?
It's we're going through this heat wave. It's been rough the last few days. Every day, I think you measure in the USA, you measure temperature in Fahrenheit. I don't know how much is in Fahrenheit, but around here is 35 degrees Celsius and above every day. So it's
Well, that's warm, right?
no, it's really, really hot. Yeah, I think
Oh, really? It's hot there? Wow.
yeah.
Yeah, Miami was not that cold this year. Usually around Christmas, it gets cold. I mean, relatively cold.
It's 95 Fahrenheit and above.
Yeah, it's warmer here than usual, but not 95, more like 80. More like, no, 75, I guess.
And 95 is the low range. So the highest it's been, I think, 107 maybe.
Oh my God.
Around that.
Whoa. Okay, Emmanuel, are you ready?
Yes, John, I am.
Okay, I'll just count down, Mauricio, okay?
Okay.
Okay, just a minute here.
Wait, give me a second, John. Let me
Yeah.
clean my desktop. Let me clean
I'll
my
gi-
desktop.
Yeah, I'll give you another minute. Yeah, it looks different. The picture looks different. You may want to center your face. Raise your camera a little bit.
Pues sí, pueden encender las luces.
Yeah, can you, your camera's not on now.
Yes, John, give me a second.
Yeah, okay. No hurry. Oh, Stephanie's here. Okay, Manuel, do you see where your head is? It's like at the corner of the picture of the screen. Can you move
It's
it to the center? Yeah. Because our last webcast, your head was almost off.
Yes, it was, but it's good. It's good. Do you see me well?
A little more centered, a little more to the, I don't know if it's your left or right, a little more. No, I guess the other way. Keep going.
It's good there?
No, you're still at the side. You're still at the side of the screen.
Okay. I gotta put myself in the center.
Yeah, no, you move your chair or whatever.
Mhm.
Perfect. Okay. Well, you're back again.
But it's
Okay,
good.
that's good. That's good enough. We can't be too picky. Okay, Mauricio, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Good morning, everybody. Good morning, good afternoon, good night. Welcome again to Neurosurgical TV. Today we have a session called Low-Cost Exoscope as an Alternative in Low-Income Countries. Another webcast by Manuel Encarnacion, a Dominican Republic neurosurgical resident in Moscow, Russia. Dr. Encarnacion, the microphone and the webcam is all yours.
Yes, hello to everyone. Thank you again to John. First, Happy New Year to everybody here. The second, once again, John, thank you for the invitation and the interest a lot of people have for this kind of instrument. This kind of instrument, we strongly believe is going to be helpful for a low-income country. So I don't want to take much time to you from the presentation, and we're going to start, okay? I'm going to share my screen with all of you. So we're going to start talking about the low-income low-income country and the situation the low-income country have to use this kind of technology. First, I need to explain, we don't have any kind of conflict of interest. This is not a company. Also, this is not like a microscope killer, okay? So this is not like it's gonna be the future of revolution. No, because we use this as an alternative method, okay? This is an alternative method to the microscope, because we need to remember, not all the places have the possibility to have a microscope, okay? The second is, we need to remember there is a lot of Exoscope in the market. There is a very good one, but also there is very expensive one in the market. So once again, this is like alternative method for these countries, on these hospitals who don't have the possibility to expend $20 or even $100,000 in Exoscope. We need to remember that more than 5 billion people have a lack of access to essential surgical care. Yes, I say 5 billion, okay? I say 5 billion. So the neurosurgical care is especially limited in the low-income countries. Studies describing neurosurgical care in low-income countries are critical for understanding global disparities in access to neurosurgical surgeries. To better understand these disparities, we can do a systematic review and the literature about the low-income country and the use of the Exoscope. Here, I show you a map of the low-income countries where they have some lack of neurosurgical studies in the use, not only in the microscope, also to the Exoscope. So we need to remember this, all these countries here, some of countries here, and some cities here, of course, also here. Some cities here, some cities here, some cities here, some cities here. They have a lack of technology for the neurosurgical care. This is a reality, we need to face it. Of course, also here. So you understand, I don't want to use this term of the first war or third war, because, you know, this is like a Cold War terminology, but there is some reality, we need to face it. Some countries don't have the same possibilities than others. For that, this low-cost Exoscope is not going to be useful in the first war, okay? So the current question is, there is a need to use a low-cost Exoscope if on the market there is a second-hand microscope and they're going to cost just $15,000 approximately. But, you know, this is a question somebody made to me. This is a question somebody made to me. The answer is it's simple. Can all the countries give $15,000 for neurosurgical department? They can, because we need to remember the situation in all the countries is not the same. The situation in all the countries is not the same. We cannot ask countries as Sierra Leone, where there is not even a single neurosurgery, to give $15,000 per a local for a microscope. So this is a reality we need to face. So here we are presenting a very low cost exoscope, because maybe I'm gonna make an open question for all of you. How much you think it costs? Can anybody answer me that question? Maybe you can maybe an estimate.
$200.
Anybody else? Don't be shy. Okay. The price is $115 USA dollars. And now I ask you, so if we can give to people the opportunity to make a good surgery and save people's life in $115 is a big step. It's a big step. So here's the specification of this low-cost exoscope. As you can see, the kind of camera it's used, and have a Panasonic 48 megapixel sensors. As you can see, it's a good picture. It's a good image. You can see the frame quality is 1,920 photons per second. It's a HDMI output, so it means we can connect in all the places. Almost all the monitors now, they have monitors or television. It's gonna be very easy to connect, and you can see it can record a video in 4K. And the white balance is automatically, of course, yes. And you see the digital zoom magnification is 5 times. Maybe you can ask, what is this? The exoscope, we put it in the microphone arm, as you can see, to give more height. But also, later I'm gonna show you a picture. What we did was we put it in a serum, in the serum stick, and we put it to give more height. So you can see it can use here TF micro card, 32 or even 64 gigabytes. So it can record a lot of videos, and then you can pass to your data collect. The frequency is 50 hertz to 60 hertz. So you can see here, this is the part of the team. We was in spinal department. We put I show you here in red. This is the microphone arm, and we set it up near to the patient table. But for example, something we figured out is, in that way, the exoscope was, we need more height, because the deep perception and the magnification was too big for the proper work. The working distance is to 50 to, it can be to 50 centimeters, even to 100 centimeters. The distance is to 50 millimeters to 1,000 millimeters, the working distance. Okay? And the ratio, as you can see, is 1/15. The magnification power, as you can see, this have a very good magnification power, is 130x. And something very important, you can see how weight, you can see it's only 195 grams. It means it's very easy to move to any kind of department, between institutions. It's gonna be very easy to move between institutions. So you can see here, the question is, it's hard to set it up, the exoscope. Well, the average time to install the exoscope is about 5 minutes. For example, here, what we figured out, if we put it in the serum stick, it has wheels, and it's gonna be very easy to move. It's gonna give us enough height to work, okay? So we we have a lot of questions, and we make different studies, because we need to remember the operative microscope and the exoscope have very significantly advanced in the modern neurosurgery. The operative microscope is a cornerstone. Right now, we can say it's a cornerstone in the neurosurgery, because almost, maybe not all, but I think more than 80% of the neurosurgical procedures, we use the microscope. Okay. Now I'm going to show you some surgeries we perform in the spinal department. As you can see here, the L5 nerve root, and you can see how very clear you can see it. In these pictures, you can see a minimal invasive sleeve with the tubular retractor. We use it, and we work very comfortable. Here, for example, we see the annulotomy, the interdisc expander, and something we figured out, the use of the exoscope when you are using, for example, the interdisc expander, is very comfortable, because sometimes we need to be very careful if we are using the microscope in that stage of the surgery, because we can break the focus, or even the lumen of the microscope. We can hit the microscope with the hammer, for example, if we are using the hammer there. But as I said to you before, because the working distance can be from 50 centimeters to 100 centimeters, we don't have any kind of interference. Okay. Here, for example, we were performing a typical T-leaf. You can see here the dural sac. The illumination is much better than in the first pictures, because we are earning some knowledge on how to use it properly. And something important is it can be very good for the teaching process, because if we can put the exoscope at 100 centimeters distance, 100 centimeter high to the operation field, even there, it's not going to bother the operating team, and it can be used for teaching. For teaching method, is going to be very good, very easy. And of course, it's a huge difference, even also in the price of the microscope, because the cover bag of the microscope is very expensive. It can cost almost $200. Only the bag. So there is some limitation, of course. The low-cost exoscope have. There is some limitation. The limitation is the visualization. The property of the visualization is, of course, is inferior to the microscope. The lighting was the biggest complaint of the equipment in the equipment. All the team complain about the light and about the feeling of the deep. The management of the reposition of the low-cost exoscope was our team, they say, was median if they compare it with the operative microscope. So, and what we did was we make a comparative study. We make a comparative study between the low-cost exoscope and the surgical microscope in the Department of Spinal Surgery in the Clinical Hospital of the Russian Academy of Science. We use 16 patients. For that, okay, that 16 patients we're dividing in 8 and 8, 2 groups. One group with the operative microscope and the other group with the low-cost exoscope. Both of this group both of the group was from degenerative spinal surgery. Both of this group we make T-leaf. In both of them, we make T-leaf, or normal T-leaf, a typical T-leaf open, And in the four and the other 8, we use a minimal invasive TLIF. All the results we're gonna publish very soon. We hope we publish very soon, and we will gonna share with all of you the results. The results are very interesting, and for that result, we make a questionnaire, we make a survey, and this is the kind of the question we start. I'm gonna show you, and this is the kind of question we made. We ask who was the one who performed the surgery, for example, and the opinion. We ask to the chief of the department, the consulting neurosurgeon, the attending neurosurgeon, the residents, and the neurosurgical scrub nurse. We ask also, was the brightness of the operative field superior when you use the low-cost exoscope compared to the conventional binocular microscope? Also, was it more convenient to perform surgery as first operator in the low-cost exoscope or in the microscope? What was the role you had in the operation of the operator, assistant operator, scrub nurse? Was the quality of the picture of the imaging of the low-cost exoscope superior to the conventional microscope? What do you think? Was it more convenient to perform the surgery as assistant or scrub nurse with the low-cost exoscope compared to the microscope? It's easy to teach with the low-cost exoscope than the microscope. Was easier to zoom with the low-cost exoscope than with the microscope? Was easier to focus with the low-cost exoscope than in the microscope? Was easy to put the position, the setup with the microscope? Also, important, after people use the low-cost exoscope, if they can recommend this kind of instrument, of this kind of exoscope to the college, so to the other doctors, they will continue. Thank God they say absolutely. Thank God they say absolutely. For different reasons, all of that results is gonna be in the paper, but I'm just gonna give you like a sneak peek. And it's like all of them, like it's very easy to use. In the beginning was, yes, because we have a learning curve that's very high, because there is you need to get used to this eye-hand movement technique to use it properly. But something important is even the cost. Even the cost for the department, because they don't need to scrub up the microscope. And as I told you before, even the back of the microscope cost much more than $100. It's gonna depend, of course, of the microscope you have, because if you have a Pentero or if you have a Pentero 900 or a Kinebo, the bag is gonna be almost $200 or even more. So if, as you can see, if in your department can use, they can reduce the cost, and still we're gonna have the same result. It's gonna be something very good for all the corners, as we can see. It's gonna have a very good result. So, do you think the low-cost exoscope have the potential to improve the neurosurgical care in the low-income countries? This is a question I'm gonna let there for all of you. So we ask which specialty we think is gonna have benefit with the low-cost exoscope. All of them, they agreed was the spinal surgery. Spinal surgery, they all of them agree is gonna be more benefit. Here, I show you some papers about the low cost, about the low-income countries and how is the situation, okay? And this picture, do you remember I didn't find a bigger one. I didn't figure out how to put bigger one, this picture. But as you can see, maybe this picture is in Africa. As you see, one doctor is using a focus and the other one is performing the surgery. And this picture, I associate, I correlate this picture with the question somebody asked me. If there is in the market a second-hand microscope, and you can get it in $15,000, why you need to get a low-cost exoscope? And I remember this picture because they're not using this focus because they want, because they're using because they are the necessity and the reality in some countries. So now I'm gonna present some of the patient of my college Peralta. Right now he cannot. It wasn't possible for him to assist, and I'm gonna present very briefly some of these of his cases. As you can see, Peralta is using a low-cost exoscope, and they're using a monitor here. Peralta is using in some cranial surgery also. This is all the equipment of the low-cost exoscope. And you can see the quality of the picture. This is the right position of the exoscope, depending on the kind of surgery you want to perform. As here you can see, it's the same. It is the same as usually we use with the microscope, but it's smaller, so it's more comfortable. Remember, it need to be in the opposite way of the operator. You can see here, and you can see this is the high definition monitor. Okay, the monitor you can see here, and you can see the exoscope monitor. Okay. For example, this is a case of neurocysticercosis Dr. Peralta made in San Juan. San Juan is a city of Dominican Republic, the country where I came from in the Caribbean. So you can see, and this is a picture from the exoscope. As you can see here, the quality of the picture are very good. This is a serial of cases of Dr. Peralta. Here you can see an aneurysm. For example, we can perform aneurysm. You can perform even tumor. You can perform neurocysticercosis. Okay, you can perform a schwannoma also. This is another serial of cases of spinal and peripheral nerve. Here you can see a peripheral nerve graft. Here you can see intramedullary tumors, for example. And this is the serial of Dr. Peralta and his team, they make it. And you can see here, we have things, the spinal, and also we have a cranial surgery. And the question is, from which one is more comfortable? Well, from the spinal, absolutely is much more comfortable because there is no necessity to move too much the exoscope. But also it can be used for the cranial surgery, of course. One of our goals now is to use two low-cost exoscopes to give two different angles, and in that way we don't need to move too much. This is something we'll try to figure out. Maybe we can use two monitors. We're gonna figure out to see how we can use it. This is the serial of the cases, and also this will be a very future publication. We hope we're gonna make it in this month. So the last conclusion are the low-cost exoscope, because maybe you can ask me, but what about the sterilization? Yes, you can use the sterilization. You can use a gas sterilization method, or you can use plasma also. This is the one I use it here. It's very easy, extremely easy to move between institutions, between hospitals. We have some limitation about the learning curve of the eye-hand coordination is take time, but it's something we can solve with the proper practice, of course. The low-cost Exoscope allow the larger operative corridors and enhance the instrument maneuverability. That is very important. As I told you before, sometimes when we are using the hammer, or when we are using very long instrument, especially in spinal, is not comfortable because we have the microscope, and we can hit the microscope. And this kind of instrument, is very expensive. And we have a less of the obstruction in the passing instrument. Yes, because when you have the microscope and you ask to your assistant, the scalpel, the forceps, for example, the scissors. Yes, it sometimes is not very comfortable. It's not very comfortable. Also important is the large monitor. Result is an immersive surgical experience and give multiple team members the same quality as they are in the surgery. Okay, thank you so much.
Okay,
Hello,
Mauricio?
Yes,
Yes, Dr. Encarnacion, thanks a lot for your presentation. It was awesome. Yeah.
Thank you.
We all learned a little bit more about low-income countries, neurosurgical treatments there, and how can we progress from here. To all the participants, you can leave some questions in the chat box, and I can read it to Dr. Encarnacion, or you can turn on your microphone and ask him yourself. We'll leave some minutes so everybody can ask something.
Okay. I'd like to start off, Emmanuel. I'm John Bennett of Neurosurgical TV. If you could put the phone numbers or addresses of various companies of the equipment, would appreciate it. When you get a chance, okay?
Yes, of course. Last time I put it here. I got it in AliExpress. I'm gonna send to all of you a link, and in that way there is different kind. I cannot recommend you one precisely because there is different brands.
Yeah, I'll send it to the mailing list of people that came here. That would be fine.
Yes.
Okay. Okay, panelists, open for comments or questions, anything you want to ask, or just to introduce yourself. Good morning, Harshad.
Good morning, John. Wish you Happy New Year, and all of you have a Happy New Year.
You got a haircut.
Yeah. Not a haircut. It's just the hair has been put it up. So how are you all fine?
Yes. How are you doing in Mumbai?
We are doing well, all well. The new year has begun. Excellent talk. Very interesting. And this low-cost exoscope and microscope is very important tool for all of us to have. And there are many who desires to have such a tool to do during just surgeries. So it will be worthwhile to have these tools available easily. And yes, you are right to get the link where it is available. And wonderful.
Yes,
Yeah. It is wonderful tool. And yes, everybody cannot afford it in a real way. But this low cost, we should use it here. Let me tell you, the exoscope in future is going to replace microscope as well as endoscope. And of course, you require a lot of eye and hand coordination for exoscope. Everybody cannot use the exoscope like everybody can use microscope or endoscope. So there is a learning curve, as you have rightly said, and people will use it. And you have shown it wonderfully. Your cases were very nice, very nice cases, very well executed.
Thank you,
It
thank
seems,
you, thank you. The
it seems
idea is every country have the proper instrument, the proper equipment for perform surgery, but you know, the reality, not all the countries can have a Bitcoin 3D, of course. It's our dream if every country have a, you know, a Kinebo, a Bitcoin 3D, but we need to figure out, the way to help others and share the information.
Yes, yesterday I was listening to one webinar of a neurosurgeon from Sri Lanka. John only has organized the neurosurgical TV. And I could find out that they don't have even ICU, they don't have beds, they don't have microscope, and still they are doing neurosurgery. Wonderful in some peripheral part of Sri Lanka. And this kind of an equipment will be very helpful to them. John?
Yes.
Yeah, did you have a microscope when you trained, Harshad, all throughout training?
Initially, yes. Initially, it was a very sparingly used, but later on, yes, microscope is very easily available, not very commonly. You see, I'm an old man with a. I started doing my neurosurgery with a carotid angiogram. We used to do puncture the carotid in the neck, and
Okay,
CT scan was a luxury at that time. In Bombay City, there was only one CT scan when I was doing my neurosurgery. Only one scanner. Now must be thousands.
right.
And wonderful tools are now available, and this low cost. Last time also I heard this low cost exoscope. Wonderful to have this, and very simple to use. It's not a very big equipment. So,
Yes,
wonderful.
very simple.
Very simple. Great. It will be a great help to the neurosurgical society.
That's what
Thank
we believe. That's what we believe, and for that reason, we are performing right now. We are running two different studies, multi-center ones,
Mhm.
and we have, I think, a good amount of patients. We have a good amount of patients, and we hope to have the results very soon.
Right. Very nice. Thank you.
To you.
Yeah, this is a comment from a non-neurosurgeon, Manuel. When the neurosurgeons start using the exoscope?
The
Do you know when? Yeah. Do you know when, Harshad, or?
Was in the 90s. I think it was in the 90s they start to use the Exoscope. In the 90s.
Okay. Is that true, Harshad? In the 90s they started using the exoscope?
Yeah. Maybe much later than the 90s. I would say the late part of the 90s and early part of 2000, they started the exoscope. And still exoscope is not available in many centers of the world. It is only with a very few people who are using. So this low cost exoscope is going to revolutionize all over the world, not only the third world countries, everywhere. Because just now it is quite expensive to have. And
Yes. Now in the department they use it rather than them at least because they're getting news and they prefer to use, for example, in the normal decompressive discectomy, they prefer to use because they say if we can reduce the cost and still give a good quality surgery to the patient, no complication, and we don't need to use the back. If we don't need to use the back of the microscope because you have a cost and we're going to have the same result, why not? And now even in the first war, they are thinking, well, we're going to have the same result, no complication. Now we get used to use it. Why not use it then?
I will tell you one thing, the complications and everything will depend on our training. All we need is good training. Everyone needs a good training for that. The tool gives us a help. It does not reduce the rate of complications. The tool like low cost exoscope or a high cost exoscope or a microscope or an endoscope, these are an additional to our surgical skill. we must learn the anatomy. We must learn how to operate, how to prevent the complications with the help of these tools. So the low cost will add and help everyone to afford it and to use it. Like an endoscope is not replacing microscope. Endoscope is an addition to the microscope. Endoscope will give you some peripheral views which you cannot reach by microscope. The same way is exoscope. So exoscope is a wonderful thing. I have used it once only, but I find difficult because I'm not trained on exoscope yet. You need to have an hand-eye coordination. Yes, we are used to with microscope and of course endoscope, but not with exoscope. Even in India, such a big country, exoscope is hardly available in centers. So this low cost will definitely make difference to the people. Right. Good, good. I'm very happy to hear.
Thank you.
Thank you.
Okay, more comments, questions?
Yeah, I have a question, Dr. Encarnacion.
Go ahead, Mauricio.
Sorry. It will not only improve surgery per se, it will also improve training. So it will lower the cost for neuroanatomy labs, neurosurgical labs, and for residents to train, and that will open a few doors in the future. So residents can train once, twice. They can always train and get better with the exoscope and with the low cost. So tomorrow, when they have access to a high-tech exoscope, or maybe even just the same low-cost exoscope, they already have the experience from the lab, and they have that experience thanks to the lower cost of the exoscope too. So the idea is really good. I really like it. It's inspiring. So we can get better from the lab to the OR, and in the future, everybody will be trained in the exoscope, and they won't have the problem that Dr. Hashad mentioned, that they don't really have that eye to hand coordination for the exoscope.
Yes.
So
As you say, in the lab, it can be used and it can have a very good result. Have a good result. Even because, you know, in the lab we need to use the microscope for training, and maybe it can be very nice to use the isoscope there. It can be very good idea. So to have some isoscope in the lab and make a lab only with the isoscope.
Okay. More comments, questions, or people just want to say hi? Okay, well, Manuel, we can continue this conversation in what we have, the Zoom lounge. I think you know what it is. It's another Zoom after this finishes, where Manuel is going to come. I'll be there. Mauricio will be there, and all panelists are invited to come. It's private, it's not televised, it's to promote interaction. Because as every doctor knows, one of the best parts about going to a conference is networking. And these days where we have isolation, we're using virtual means to communicate. Networking paradoxically can increase, I think, can get better than the other times. So anyways, thank you very much, Manuel. And
My pleasure.
Copy this link, Manuel, as anybody else can copy the link. It's in the chat. Just copy that link. And after this Zoom ends, use that link because you can't be on two Zooms at the same time.
Yes, yes.
So just copy that link. You got that link, Manuel? Okay, just save that.
I check it now.
Okay, Mauricio, you got that link, right?
yeah, I got it.
Stephanie, good morning. You got the link, Stephanie?
Good morning, doctor. Thank you. Yeah, I got the link.
Okay, I'm going to end this, and we'll see everyone in the lounge for a private meeting with
Okay,
everyone
thank you so much,
else.
John. Thank you to all the participants.
Okay, Manuel, thank you.
Okay.
We'll see you at the lounge.
Okay, John.